And a new Gallup poll finds 77% of Americans surveyed are very confident in the Trump administration's ability to handle the coronavirus outbreak. That's higher than any administration in any of the previous health scares that the country has had. Joining us tonight, Fox News medical correspondent, Dr. Marc Siegel. Doctor, good to have you with us. Are you impressed by that, the number of Americans who've got that much confidence in the Trump administration?
Absolutely, Lou. I think that the task force that the president put together and his leadership on this has been tremendous. I have followed health scares, as you know, for many years and contagions. And you know what's different this time? The messaging. Because we have this enormous threat to us over there in China, infecting probably well over 100,000 people in real numbers. And the messaging from CDC, from NIH, from the president, from Alex Azar, from the Department of Homeland Security has been, here's what we're doing to try to contain it here. Transparency. Here's what the numbers are in here. Here's how we're isolating people. They're spreading confidence.
And every one of those people you mentioned, including yourself, have been straightforward, treating the audience of this broadcast and all of our fellow citizens as adults. Straight talk and some careful language as well, just because you don't want to overstate the situation. I understand that. But this has been a remarkable exercise for the American people, because we're sitting here still with 15, it's 15 right now, who've come down with a virus. I think it's being managed well. The results speak for themselves.
And for people who like to criticize the American healthcare system, you only have to look at how China is handling this with suppression, disinformation, quarantines, fear, panic. Here we have...
Well, that's not a difference in just medical systems. That's a difference in government. Authoritarian versus a constitutional republic. Free enterprise, capitalist economy versus a communist country with some markets.
Fair enough. And they have actually excellent scientists over there who are not getting to do their job, and they're being suppressed as well. I still say, and I've said it before on this show, we need CDC to be over there helping to guide the situation so we get even more information.
Well, it is irresponsible of the Chinese to not have the best minds and trained talent in the world from our medical and scientists. This is just, anyway, it's discomforting, to say the very least, that the Chinese would risk so much for their own country when they're being offered help by the World Health Organization, the United States, and only accepting it at the margin. Right now, I want to turn to the virus itself and what we know about it. The University of Texas, the NIH, coming up with one vaccine that is very promising. Others are doing the same thing. I think there are about 5 channels of companies and scientists organized with medical researchers to deal with this. It looks very promising, I'm told, of what they're already seeing develop in the way of a potential vaccine.
Absolutely. A couple of points about that. And this all helps to calm fears. We're learning how this virus operates. It's a lot like the flu in that it goes to upper and lower respiratory tracts. We know it's wildly contagious. We know its death rate is probably 1 to 2%.
How soon the vaccine?
Vaccine, about a year before it's on the market. But antiviral drugs...
I want it sooner.
You had Tony Fauci on the show here. He's shepherding this. He's putting a lot of weight on this. It's got to enter clinical trials. They're going to put billions into this. I'd like to see it by next fall, because that's when we're really going to see a resurgence of this virus.
It behaves like a flu, an influenza.
It behaves like a flu, a little bit more deadly than the flu because of the pneumonia that's associated with it.
It's also astonishing how deadly the flu has become. We went through a very heavy B strain of flu. Now I understand that it's reemerging and that we are seeing people susceptible to both the A and B strain. How serious is that?
This is an extremely bad flu season, and we're overlooking it a little bit here, but it's already infected over 25 million Americans.
Who do you think trained me? You.
We've talked about the flu a long time. One more point, Lou, I want to say before I leave. You had Peter Navarro on here talking about antiviral drugs. That's another promising thing with coronavirus.
All right. We'll keep the good news coming, right?
We will.
You got it. Thanks so much, Dr. Marc Siegel.